Please welcome Seema Verma to the stage.
Well, good morning and welcome to the 2024 Oracle Health Summit and to Nashville, the future location of Oracle headquarters. So during our time together, we hope to offer you a glimpse into the not-too-distant future to show you how Oracle plans to transform healthcare end-to-end across the globe. And our agenda includes an all-star lineup with current and former government officials, not just me, our partners and customers, and you will hear directly from our chairman and CTO, Larry Ellison, and our CEO, Safra Catz. So this past year was filled with exciting developments. We completed the largest EHR implementation in the world for the United States Department of Defense, and we're working on restarting deployments with the Veterans Administration. And we've also demonstrated the power of Oracle engineering with the release of the clinical AI agent, which has documented almost a 50% reduction in EHR usage time. And the new Oracle Health Patient Accounting product automates scheduling and registration to increase billing accuracy. Health Data Intelligence, or HDI, has helped customers close more than 200 care gaps and increase annual wellness visits by up to 60% while reducing their cost by 12%. And this EHR agnostic product is so good that our competitors' customers are already using it. But let me briefly address the elephant in the room. So we're a week out from the 2024 elections. And elections always have consequences, and this one will be no different. And certainly the United States healthcare system has been profoundly shaped by the results of major elections, going back to the creation of Medicare and Medicaid, Medicare Advantage, the Part D program, and the passage of the Affordable Care Act. And in the UK, the historic creation of the National Health Service. But governments are not the only driver of change. Science and technology have played an even more significant role in shaping the economy and society, from the steam engine and electricity in the 19th century to semiconductors and microchips that sparked the digital age. But regrettably, both government policy and advances in technology have fallen short of driving the transformation that we all crave. Instead, our healthcare systems, while delivering astounding innovation in treatment and therapies, have become more complex, more fragmented, more expensive, and more difficult to access. I've always believed that well-intended government policy has often created more problems than it solves. And at the same time, the technology innovations that have fundamentally transformed other sectors of our economy have been absent in healthcare. I mean, healthcare is still using the fax machine. But I think you would all agree that today's most widely used healthcare technology, the EHR, electronic health record, has actually had negative effects on providers and patients. Too many clinical professionals have burned out, sold their practices, and lost their love of medicine, thanks to the robotic, soul-crushing, mundane tasks that current EHRs force on them. And moreover, today's EHRs, built on 1990s technology platforms, can't deliver any real innovation, forcing providers to seek a myriad of third-party point solutions. And these bolted-on products create multiple entry points for hackers and have left the industry highly vulnerable to cyber attacks, exposing sensitive data, even patient genetic information. And we're going to hear more about that this afternoon from Dr. Redfield, the former CDC director. So astronauts can live for months in a space station, but we still haven't figured out how to move and use digital health data effectively so that we have the information we need when we need it, and we can leverage it to make critical decisions for patients. And tragically, EHR data has been intentionally siloed, restricted from use across the entire healthcare ecosystem. And can anyone doubt that patients have been harmed by this, that clinical innovation has been thwarted. And I can tell you from my time on the White House COVID task force that this lack of data sharing made responding to the world's worst public health crisis much more difficult than it should have been in the 21st century. And too often, we didn't even know where to send supplies and medicine because we didn't have access to real-time data from hospitals. And this has got to change because it's simply not sustainable. But fortunately, I believe that we have reached a tipping point where digital technologies can finally deliver on the promise of transforming healthcare. And earlier this year, our founder, Larry Ellison, took the principled position that it's Oracle's moral obligation to fix the dysfunction of our current system. And I know what you're thinking, because I once thought it myself. Here comes another technology company thinking that it can fix our vastly complex healthcare system. But here's what's different. Oracle is positioned like no other company in the world to provide the healthcare system with a comprehensive set of tools and capabilities to reduce costs, increase efficiency, enhance clinical outcomes, and accelerate innovation. And the foundation starts with our heritage of managing much of the world's most valuable data with the Oracle database. And it continues with Oracle Cloud Infrastructure, our high-speed infrastructure, which provides a faster, more affordable, scalable platform for running mission-critical business systems. And moreover, the Oracle Cloud provides built-in protection from cyber attacks. Indeed, many of the world's biggest banks, retail and hospitality businesses, communications companies, government agencies, including the intelligence community, trust Oracle technology to protect their data because of the powerful security our cloud offers. Oracle Health is at the center of the exploding AI revolution, and we are leveraging our top AI engineers to work on our healthcare portfolio. And this gives us the unique expertise that we need to harness the power of AI. And we've also learned from the mistakes of those that have come before us. And we have the humility to recognize that we need the knowledge and experience of frontline clinicians and administrators to help us develop state-of-the-art products. And finally, Oracle is the only technology company that has demonstrated their commitment to healthcare with the acquisition of the largest EHR in the world. And Oracle also has a suite of applications to address the full spectrum of a modern company's everyday business functions, from finance to HR, supply chain management, and we're designing new versions of these products to integrate with the EHR to help increase the productivity and efficiency the industry so desperately needs. Thank you.